Greetings and welcome to my video presentation on Bromazepam. In this video, we will explore drug introduction, pharmacokinetics, its pharmacodynamics, drug effects, interdisciplinary team, and finally some counseling considerations. What is Bromazepam? Bromazepam is a fast-acting benzodiazepam used to treat panic disorder and severe anxiety. It belongs to a drug class known as benzodiazepam. Bromazepam is indicated for short-term treatment of insomnia and short-term treatment of anxiety or panic attacks. It's also indicated for alleviating the symptoms of alcohol withdrawal and opioids. Let's talk about formulation of Bromazepam. Bromazepam are formulated in capsule, tablet, and in solution and suspension as well. The usual dosage of bromazepam range from 6 to 18 mg divided equally throughout the day. Lower doses such as 3 mg per day may be necessary for debilitated or older patients. Thus, it is necessary for healthcare provider to monitor by regularly assessing as it can cause dependence and addiction. There are several other brand names that can be found for bromazepam. Some of the common brand names are Lexotan, Lexotanil, Bromolex, Lexotan, and it goes on. It depends upon in which country you are based, the brand names. Into pharmacokinetics of bromazepam. Absorption. It has 84% of bioavailability following oral administration and a peak plasma level in 1 to 4 hours. Bromazepam distribution. Bromazepam has distributed volume of 1.56 liter per kilogram. Its metabolism. It's primarily metabolized in the liver through oxidative pathways with one active metabolite, 3-hydroxybromazepam, sharing a half-life. And finally, the elimination. Approximately 69% of bromazepam is excreted through urine with a half-life of 10 to 20 hours and a clearance rate of 0.82 milliliter per minute per kilogram. Bromazepam is known for its hypnotic, sedative, anxiolytic, and muscle relaxants. When a person is experiencing panic attack or anxiety, if a person takes bromazepam, this bromazepam binds with the GABA receptor of benzodiazepines. Thus, these bindings of GABA receptors and bromazepam releases a positive allosteric modulator. This positive allosteric modulator increases its efficacy and affinity by causing a calm effect on a person, thus helping it to relax and calm down. However, this does not affect other neurotransmitters such as dopamine or serotonin. Like any other drugs, bromazepam also has its own side effects. Some of the side effects I mentioned are drowsiness, difficulty breathing, depression, hallucination, constipation, bone fracture, fall, and skin rash. I have also mentioned some common side effects and some severe side effects. Now, it's important for a person taking bromazepam to remember that if any of these severe side effects occurs, it is important to contact with the healthcare provider immediately as it can cause some serious problems. Bromazepam belongs to Schedule IV drugs, which means prescriptions only medicine. It can be prescribed by doctor, nurses, and midwives. Bromazepam is also called as prescribed restricted drugs as it can cause addictions. Some other examples of S4 are barbiturates and anabolic androgenic steroid. Now the counseling consideration. A person shouldn't take bromazepam with opioids or alcohol as it can cause addiction. Pregnancy women and breastfeeding mothers should inform their healthcare provider as bromazepam may affect your baby. Bromazepam can interact with other medications, so always consult with your healthcare provider before starting or stopping any other drugs. Do not take Bromazepam if you are allergic to any benzodiazepine medicines, or if you have any medical conditions relating to lung disease, respiratory, or liver, as it can worsen the situation.